Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. Our mission is to promote policies and programs that enable seniors to live with independence and dignity in their communities. Aging Insights programs have addressed a variety of topics, including health issues, economic and food security, creativity, and fitness. Today, we're going to talk about Medicare. Open enrollment season is here, and there are things everyone needs to know. In addition to that, fraud is something that Medicare recipients should always be on the lookout for. So today's guests are experts on both of these topics. I have in the studio with me today Charles Clarkson and Tunde Akinrolimbu from the Senior Medicare Patrol of New Jersey. We know in New Jersey we have more than 1 million residents over age 65. So we want to review some of the details related to the open enrollment, Medicare open enrollment. And with that, we'll begin the interview with Charles. Thank you very much for being here, both of you.
Thank you for having us.
Thanks for having us.
You know, I think it's important to sort of talk about Senior Medicare Patrol, and we'll do that after we talk about some of the basics about open enrollment. So what are the dates this year for open enrollment, Charles?
Well, the dates by law now or by regulation are October 15th to December 7th of every year, unless that changes in the future. So now people should start looking at their Medicare coverage and see whether or not any changes they might want to make during the open enrollment period.
And this is for people that are already enrolled in Medicare.
That's right. Or if you didn't enroll when you were first eligible to enroll, now you can enroll also.
And are there resources to help people to get the best information?
Yes, of course. There's the Medicare.gov website, which basically has a ton of information about enrollment and plans. And also there is a plan finder for the drug plans and the Medicare Advantage plans on the Medicare.gov website. And of course, if you got your 2016 Medicare and You book, basically this is a good resource to basically give you an overview of what you can do. And also in the back, it lists the plans that are available in the state of New Jersey.
And that's directly mailed to people?
Yeah, most people should have got, I've already gotten mine mailed to me, so I presume most people got theirs.
And does it come in other languages? Is it always
Yes,
English?
it does. It is available in a number of languages. I think 18, I think,
oh, really?
Are available, yeah. I'm not sure about the book, but I know the Medicare website has a lot of languages, and a lot of this stuff you can download right online and read it.
Well, I think that's very helpful. You know, our last show, we also talked about Medicare basics, and so we talked a little bit about traditional and Medicare Advantage. And is that something that's important during open enrollment time?
Yes, because you could switch back and forth. So if you're on original Medicare, which means you usually have Part A and Part B, and usually you have a supplemental plan, sometimes called a Medigap policy, and then you usually buy a separate drug plan, Part D. That's the line for original Medicare. But you can also join a Medicare Advantage plan, which is basically a private company that has the full services of Medicare, but the supplement and the drug plan are usually included right in the Medicare Advantage plan, and therefore you don't need to buy a supplement and a drug plan. Obviously, the disadvantage is that most of those plans have a network. So if you're in a Medicare Advantage plan, you got to make sure you go to a hospital or a doctor in the network.
And are those supplemental plans described in the booklet?
Not the supplements, but the Medicare Advantage plans are. Okay.
Okay.
There's a separate, you can find out the supplement plans that are available in your area, and you could also call us at the Senior Medicare Patrol and we can direct you to it to get a list of those.
Well, you know, you sort of jumped ahead to talk about the Senior Medicare Patrol, so I'm very glad you're both here, and I know you and Tunde do a lot of programs. So Tunde, why don't you give us a description of the Senior Medicare Patrol?
Sure, absolutely. Senior Medicare Patrol, we're a national program. We're federally funded by the Administration for Community Living. And there's one Senior Medicare Patrol in every state. So we represent the SMP of New Jersey. And the goal of the Senior Medicare Patrol is to educate Medicare beneficiaries, those 65 and older, and those on disability that are receiving Medicare, and to educate them on Medicare fraud and abuse, because we realize the more educated seniors are, the more empowered they can become, and the more they will be able to detect, protect themselves from fraud and abuse, and report Medicare fraud and abuse.
So I think it's nice you're both here because I'm going to go in between. So one of the things we talked about was the Medicare summary notice. So Charles, why is that important, and does everyone get it? Is it routine whether or not you've gone to the doctor?
Well, if you're
what?
on original Medicare and you go see a doctor that's in Medicare, yes, you should be getting a Medicare summary notice. Usually that comes 90 days after the fact. And while it's important, the reason it's important is because it lists all the payments that Medicare made on your behalf. So it's extremely important that everybody read the Medicare summary notice, because that tells them what service they got, how much Medicare paid, and then how much they may owe if they don't have like a supplement or some other plan to help cover that. And that'll be the first clue as to whether or not there might be something on there that's in error or actual fraud.
So would they also see information, I may have missed it when you said it, would they also see information from Part D? Let's talk about what Part D is.
No, Part D is a separate private drug plan, and you'll get a separate statement from your Part D company which lists the drugs you may have bought during that period and the cost to you, and that usually comes out a little differently from the Medicare summary notice. It comes out whenever the plan decides, on a basic that you basically bought some drugs, and they send you notice of that.
So during open enrollment, people are also looking at Part D.
That is the most important thing to look at, because the Part D plans change every year. The premiums change, the deductible change, and of course the formulary, the list of drugs on the plans change. And you really want to make sure that next year, for 2016, you want to compare plans, because you may not be in the best plan for next year. You may like your plan now, but it may be more expensive next year because that plan may have changed, and you won't know unless you do a comparison.
So let's talk about what kind of changes. So if someone's getting a prescription and it's maybe a brand name, so is that something?
Yeah, the drug company can say, we're dropping this drug. We don't want to cover this anymore.
The prescription program.
Right, and because it's it's an economic decision on their part. So you don't want to go next year and find out your drug is not on the formulary, and then you're going to wind up paying the full price for it, when if you did a comparison, you might find a plan that covered all your drugs and save you money over the entire year.
So is Part D covered in the book? No.
No. Well, the Part D plans are covered, but that just lists the plan and the premium for the month. It doesn't really tell you what's the best plan for you. What you want to do is go to the Medicare website, pick on Select Health and Drug Plans, and then you can do a personal search. You can put your name, your Medicare number, and then eventually you'll put in your list of drugs and your dosage, and then it'll come up and say, these are the plans that are cheapest in a certain order from the lowest to the most expensive. And what you want to look at is the estimated annual drug retail cost. In other words, what is it going to cost me to go to the drugstore and buy these drugs over the entire year? Ignore the premium, ignore the deductible, because that may not be the better indication. You want to know what the annual cost is, and then we always tell people, if it's a decently rated program, the Part D plan, go into the cheapest plan.
So perhaps, since I'm not necessarily a regular Medicare user, will be, but I'm not. So if you're, if you're taking an osteoporosis drug or you're taking a hypertension drug, and so you know what the regular cost is, that's what should be helping you make your decisions.
That's right, because you can, the plan finder will tell you different items you can search. You can search plans by premium, by name, by estimated annual cost, by deductible, and we say ignore all that.
By drugstore?
Huh?
By drugstore? By the
No, not by drugstore.
Oh, I was just curious. Okay.
No, but but we want to know what it's going to cost us over the entire year, and the premium, the deductible, and the cost of the drugs are included in the estimated annual cost.
Okay.
So that includes all that information. Then we just say pick the cheapest plan, because all of these plans are approved by the federal government, and most of them work well.
Okay. And when you make your selection, when do these new plans take effect?
They will not take place until January 1st of 2016, but you only can change plans during the open enrollment period.
And that's true of both the Medicare Advantage and
Yes,
the traditional.
that's true.
So, you know, there's an awful lot of information out there. So I see you've got the booklet, and you're suggesting that people go online.
That's
for the
correct,
details.
because that really basically gives all the up-to-date information and does the comparison for you. It's very hard for you to do a comparison. I mean, you can call up every drug company all the plans,
Really?
and make a spreadsheet, but why go through all that work when the Medicare.gov website will do that for you?
It has the spreadsheet there, so I know
Yeah.
you've been nice enough to show it to
right.
me in the past. So I think that there's a lot of wonderful information there. So since you both make presentations on SMP, I bet you're really busy, though, during open enrollment time.
Oh, absolutely, yes. Open enrollment, it's a unique time when we go out and give our presentations, because this is also the time and we're switching to fraud here. This is also the time where there are a lot of illegal solicitors that come out. So I'll speak a little bit about that. CMS, Medicare, sets very specific soliciting rules for insurance brokers during the time. And being open enrollment is the time where insurance brokers can garner new business, sign people up for new Medicare Advantage plans, sign people up for new Part D prescription drug plans. A lot of illegal soliciting goes on. A few examples of that would be, for example, insurance brokers are not allowed to call potential enrollees on their phone. All right, so there's no cold calling, there's no door-to-door sales. What we see often happening, especially in senior residences now, is illegal solicitors, insurance brokers that find their ways into common areas of the building and try to enroll seniors into Medicare Advantage plans and sometimes even Part D prescription drug plans, and that's actually against the law. So a company like Aetna or United Healthcare, they are allowed to conduct educational sessions during this time, but there are very strict rules that if they do conduct educational sessions in senior buildings, they're not allowed right after the educational session or during the educational session, they're not allowed to enroll any beneficiaries into insurance plans. So usually around this time, we give our usual Medicare fraud presentation, but we also like to add in the illegal soliciting, just so beneficiaries are aware of what might go on around.
So you don't
open
need a
enrollment.
broker to sign up.
No.
Right?
No. As a matter of fact, I should have mentioned this earlier to you, but you know, the SHIP program in the state of New Jersey, the State Health Insurance Assistance Program, is available to anybody out there. All they have to do is call SHIP and go in, make an appointment, bring their information. If you want to change drug plans, bring all your drugs, you know, your dosage, and they can do the search for you. And it is difficult. I'm not suggesting, if you're not familiar with the computer and you've never done the comparison, you might want to seek assistance from SHIP or call us at the Senior Medicare Patrol, and we can help you also.
Well, we will be sure to put the SHIP number on the screen so our viewers can see it, and as well as your numbers. I do think I think there are some complicated issues here, so it's nice to have help, and I imagine that so you must go out a lot, I mean, to do these presentations?
Yeah.
Sure.
We're probably busy every day until the end of November.
Monday through Friday, sometimes Saturdays and Sundays.
Right.
Saturdays and Sundays.
Yes, whenever and whatever a senior facility or senior group needs us, if our calendar is open for that time, whether it's Sunday night, Sunday morning, we've done churches where senior groups meet. We do health fairs on Saturday afternoons. We've done conferences. We travel through the whole state of New Jersey, wherever we're needed. The job or the mission is to educate and empower as many seniors as we can, because we realize the more they know about Medicare fraud and abuse, the more they can protect themselves and the more they can return money back to the Medicare Trust Fund.
And I understand you have some materials that you also usually bring, so I think that's helpful. I know you have a brochure on reporting abuse or fraud, and I think you also have a prescription book or something.
Well, we have a personal health care journal, and we like people to keep track of their medical appointments. And whenever they take a lab test, go to the hospital, go to a doctor, write it down. And then when they get their Medicare summary notice, they compare the two and make sure they're not being cheated. Make sure there's nothing on there that's not in their calendar. At least that'll give them the first clue that maybe there's something wrong.
And what should they do if they do notice something wrong?
If they notice something wrong, give Senior Medicare Patrol a call. This is what our usual normal process. Normally when people give us a phone call and they say there's something wrong, it's usually they look at their Medicare summary notice and they see a service or a product on there that they didn't receive, whether it's a wheelchair that they did not rent, right? Or whether it's a blood test or a CAT scan that they never received. So the first line of duty is for us to ask them to send us a Medicare summary notice after, of course, they send us a release of authorization to make sure that we're allowed to actually look through their private information.
Is this in person, on the phone, or
It's
email?
usually over the phone that this happens. Now, of course, there's sometimes when we're given presentations, and after the presentations, beneficiaries will come up and sometimes they'll have documentation ready for us. But most of the times they'll give us a phone call and we'll ask them to mail us a Medicare summary notice. If they want to fax it to us, they can as well. We'll review the Medicare summary notice. We will listen to the beneficiary side of the story. And usually the beneficiary will say, well, I see a CAT scan on here. I didn't receive this CAT scan. And we try to solve the issues in-house at first. If it's depending on the severity of the issue. Try to solve it in-house at first.
So what does that mean? Are you contacting the provider?
Yes. Okay. There are times where we'll contact the provider and try to resolve it amicably, because as much as there's a lot of Medicare fraud that goes on in this country, about 60 to 100 billion dollars a year, there's also a lot of honest mistakes and errors that also happen.
Okay.
Right.
So we approach it first like maybe there's an honest mistake that happened. Billing issues and billing errors happen all the time. And we try to resolve it amicably. Most times we can, and if it seems like there's an issue where there's blatant fraud, or as we dig deeper we see more issues of fraud or more areas of fraud, then we can refer the issue out to other agencies such as the Office of Inspector General.
So you have an enforcement legal authority that you can go to.
That's right. That's right.
And when seniors bring these issues to you, have they already called the provider? Or are they hesitant to call the provider?
Most of the time, well, you know what, I wouldn't say most, I would say maybe 50-50. So, you know, many senior citizens they have a relationship with their provider that they don't want to harm. And they're also non-confrontational. So many times they'll call us first to be confrontational with their provider. And other times we get senior citizens that are very confrontational and they've called and spoken to their provider and the provider hasn't been willing to work with them. So they ask for us to advocate for them.
Yeah, I think that role of advocacy is probably really important. As you mentioned, the SHIP program and SMP, I think, you know, the idea of someone helping someone sort of sort out the details is probably key. And Charles, you probably go all over the state.
Absolutely true. I think I have a presentation every day until the end of November. Because this is the busy period for us, and we get plenty of calls, and I even have to turn down some sites because I said, I'm sorry, I'm already booked that day, and Tunday's already booked that day.
When he turns them down, he usually sends them to me.
Well, I know we're very fortunate that you're even here, because I know it's dicey to kind of get a slice of your time. So
yeah, but it's a worthwhile program, and actually I enjoy being out in the community giving the presentations. I never thought I was good at that, but turned out that I am a good speaker, and people seem to enjoy it.
There's so many details to go through. The idea that someone can sit down and show you their Medicare summary sheet.
Yeah, because Medicare is very complicated.
I agree.
And people don't realize it, you know, and people, especially when they enroll, you know, they really don't know, you know, how it works, if they're still working, what if they're retired, you know, what if they already have coverage from their retirement, how does all this fit in together? And, you know, you might be able to read the book, but you say, I still have a lot of questions.
When we had the SHIP person here from the state and their volunteer, and that's really what they said, you know, it's especially when you're new to Medicare, or even if you're in it 1 or 2 years, if things change, you need to check. And the idea of sitting across the table, getting their Medicare 101 pages together really does help.
That's right.
And Medicare, of course, as we mentioned before, is very confusing.
Right.
And during open enrollment period, I hate to go back to insurance brokers, but I will. During open enrollment period, certain insurance brokers take advantage of the confusion out there and sometimes enroll beneficiaries in plans that they're not completely aware of what they're enrolling in. One very common issue that we see during this time is something called upselling. So we talked earlier about Medicare Advantage and Medigap and Original Medicare. Many people are confused as to the difference between Medicare Advantage, a Medicare HMO, and a Medigap plan. So one common upselling issue is an insurance broker, if a beneficiary is interested in a Medigap plan, right, a secondary insurance, the insurance broker will come in and convince them to take a Medicare Advantage plan, which is an upsell because the insurance broker gets a higher commission off of a Medicare Advantage than signing them up for a Medigap plan.
And my understanding is that Medicare Advantage it's all in one package.
That's correct.
Which makes it look simpler. But,
that's correct.
And the Medicare traditional plan with the supplemental plans is also, it just means you have part A, B, C, and D.
Well, you have part A, B, Medigap, and D.
Exactly.
Right.
So
it's
C
more
is
confusing
Medicare Advantage.
right. So it seems more confusing. Oh, I just want the one that's easy.
Right,
And
exactly.
you're saying,
And that can work for some people.
Oh, I'm sure.
Actually, 30% of all new enrollees in a Medicare are now enrolling in Medicare Advantage plan. It used to be 25%, but it's gotten better. And the reason might be because initially it could be cheaper.
Yeah, New
You don't
Jersey-
need to buy a supplement, you don't
Right.
need to buy a drug plan because that's already included in the supplement or the Medigap plan.
I do think New Jersey was slow to take on the Medicare Advantage plans because you mentioned now it's working its way up to 30%. So I think when people are leaving their work life, they're used to an all-encompassing plan, so it may
That's
sound
true.
like what they're used to. Tunde, I cut you off. What were you
No,
going to say?
I just wanted to add on to that. Medicare Advantage can be very beneficial, but the potential harm in having a beneficiary sign up to Medicare Advantage when they do not know exactly what it is they are going from original Medicare to a Medicare Advantage, meaning they're going from an open network to a closed network of providers. So
True.
many beneficiaries during this time sign up for Medicare Advantage. They do not have the full details. And then once they sign up, they continue going to see the same doctor that they saw before and end up being stuck with the bill because now they have to go and see a select network of providers.
And so I guess that's another interesting piece to consider when you are looking at the plans as to where your providers are located.
Absolutely. You really should check every one of your providers and say, what plans are you in? And of course, if they're in a plan and that can save you money, that might be okay. But if you're in if you have chronic conditions or you need to see specialists, sometimes being in a Medicare Advantage plan is not the best for you because you might need prior approval to see a specialist.
Right.
You might have to get a referral before you can see a specialist. So there can be some limitations. And whereas if you're in original Medicare, as long as that doctor accepts Medicare and is in the Medicare program, you can go.
And is there actually a savings in the Medicare Advantage program?
Yeah, they can be.
Sometimes there can
Yes,
be.
there is. Generally speaking, Medicare Advantage plans are cheaper, mainly because a Medicare Advantage
it's
package is a full,
limited, right.
combination package, and you don't have to take out a secondary insurance Medigap. So generally they're cheaper, but the difference is Medicare Advantage plans have copays. So every time you go to a doctor's office, let's say the copay is $50, as opposed to original Medicare where there are no copays. So if you're a fairly sick person and you're going to the doctor's office often, it can add up and might cost more than original Medicare.
So how do viewers get to you to have a program? What number should they be calling?
You can reach us at, to have a program, we'll give you the 732-777-1940 phone number. And if you have any suspicion of fraud, or you just have a question on your Medicare summary notice or reviewing it, you can call us at 1-877-SMP 4359. That's our SMP hotline.
Right.
The S&P hotline.
S&P hotline.
All right.
Yeah.
Well, I appreciate you both being here. I think that we've really given our viewers a lot of information. Today's our 50th show.
Congratulations.
And I understand Medicare is 50 years old.
That's right. Celebrated. It was established in 1965. It went into effect in '66.
Yeah. So where are the balloons? Anyway, so there's the two of you. Are there other individuals that assist?
Yes, we have about 50 trained volunteers, and they go through a very exhaustive learning about Medicare, coming to presentations, learning how to give presentations, and we also have people that just love to investigate some of these cases and try to help the beneficiary get the money back. So if you call us, a guy who handles these complex issues will assign a volunteer to you, and that volunteer takes it from the beginning until the end.
Well, that must be very reassuring to the person that's calling.
Sure. Yeah.
So thank you.
We give one-on-one treatment.
That's great. So thank you very much. I think
Okay.
that will be very helpful to people. Aging Insights is produced by the New Jersey Foundation for Aging. To give us feedback on this show or to help us sponsor future Aging Insights programs, please go to our website at www.njfoundationforaging.org, or you can call our office at 609-421-0206. We want to remind you to find out about senior services in your area, even your SHIP office. You can contact your county office on aging. You'll see a listing of their numbers on our website, or you can call the state hotline number for the county offices on aging and where SHIP is at 1-877-222-3737. Thank you for watching this episode of Aging Insights, and remember, aging is everyone's business.